Hi, I'm Dr. Daniel Chan. I'm a medical oncologist. As a medical oncologist, I look after cancer patients. Very often, when the patient comes in, especially those with more advanced cancers, I will actually tell them, look, I know this is your preference, you don't want chemotherapy, but you have to do what is needed. It's exactly what happened in Marianne's case. She had a tumor the size of a grapefruit, and my colleagues in respiratory medicine and in thoracic surgery suspected that she had a cancer, in this case, Hodgkin's lymphoma.
My name is Dr. Kevin Tay. I'm primarily based at Mount Elizabeth Novena Hospital. One of my main subspecialties is in hematological cancers such as lymphomas. My role in Rat's case is as a primary oncologist. For first-line Hodgkin's lymphoma, we typically give chemotherapy followed by radiation treatment to the involved areas.
Hello, I'm Dr. Lee Ko An, and I'm a radiation oncologist. The radiation oncologist's job is a bit like a surgeon. So whereas a surgeon cuts with a knife, we use X-rays to sort of cut the tumor. We have a scan to see the patient in 3D to identify each of these important structures where the cancer and the normal organs are to achieve cure with as little side effects as possible.
So the first thing you have to get through is this acceptance. Being so fit, they cannot believe that they have cancer. So she scolded me and all that, and after a while we would joke, sometimes call each other names, and it was all great fun, and she breezed through treatment, and subsequent treatment was all outpatient. As a doctor, I really get to understand after many years of practice why it's not just a science, but it's an art also. So you really just had to hear her out.
Up to 90% of patients will be cured from this type of cancers. Most of them will be cured, but then we need to make sure that they also have a good quality of life after they've completed all their treatments. I think when we are treating younger patients, one of the key issues that we do have to discuss with our patients is family planning. Because infertility is one of the side effects of chemotherapy. And we do routinely check the lung as well as the heart function, because these are some of the organs that may be affected by chemotherapy as well as radiation treatment.
There may be some side effects depending on where we shoot the radiation. So we have many new techniques that are able to deliver this radiation in a precise way. And so this is a thermoplastic shell. It comes as a flat sheet, and when it's warmed, it will be softened. And then we place it over the patient's face and head and shoulders, prevent the patient from moving during the treatment within an accuracy of 3 to 5 millimeters, and then the actual treatment beams will start. When patients are on treatment, they may start to have some side effects or questions that they didn't think of earlier in the first consult. And they have easy and free access to meet the doctor again so that I'm able to explain and address those concerns.
What is good is often to pair up these patients with a similar disease profile, maybe even similar age group. In this case for Marianne, I felt that she really could hit it off with another young lady who was diagnosed maybe a little bit earlier than her, a fellow patient who has been through it all, to give them that advice, to be a buddy to each other.
Patients are usually very susceptible to infections due to a lowered immune system. And Rat one time had developed fever. She contacted me at night. It's always good that patient lets me know early so that we can actually treat it quickly. It's also reassuring for her, right, to have your doctors being on standby for you at any time point.